a Manda Agni. So in the Manda Agni case, there also you would want to actually apply the honey on the area that has the ulceration. And then when the person starts to salivate, ask them to spit it out. Spit out the honey with the saliva. Don't swallow it, because what happens is that saliva is a way of the body flushing out the bacteria, and the honey really sort of initiates the salivation because of the sweet taste, but it also actually draws out the bacteria. So in that saliva and honey mixed concoction in your mouth, that has a lot of bacteria in it. So you do not want to swallow that. You want to spit that out. So that's a good way to look at, those infections that you usually have in the mouth. If it's lower down in the tract, then again, depending on how you're looking at the association, and you're looking at the different presentation dosha-wise. So if it's like a Vattaja, then you go by the same sort of treatment for the Vattaja type of GIT issues, whether it be Grahani or whether it be Arshas or anything like that. You'd still look at it in the same way. You still have to increase Agni, because in almost all those conditions, it is still Manda Agni. However, you do want to use other substances with whatever you're using for increasing the Agni that will help to pacify these infections. So a great example of that is Amlaki. Amla has this great ability to fight off infections, to prevent bacterial growth. As well, it's a much milder version, but it does still help to increase Agni. So in the list of all the things that we have that would increase Agni, this is a mild version of that. Okay, how many therapies can or should we have people doing? Takra, Gandharvasta, the other herb formulas. It really depends on how many of these therapies you want to have one person doing at the same time. If, for instance, we've talked about this a little bit as well, is that depending on the severity of the condition, you would decide, or you would choose whether you want to have just Takra alone, or if they're stronger, that they can handle something else. So earlier I had this discussion with someone, and we talked about, the different presentations of a chronic Grahani issue. So in a Grahani patient, you can have a chronic Grahani patient that has the loose stools or the loose motions, and they can be a chronic patient that is strong, or they can be a chronic patient that is weak. So what do we mean by a chronic patient that's strong? Someone who still has the integrity of their dhatus, who can still be able to carry on even though they're having this condition. You don't see a deterioration in the quality of their dhatus. And you know how to assess if someone's dhatus are healthy and normal, or if they're not. Their bodies is going to basically tell you that, or the functions or the abnormal functions that are carried out by these dhatus are really going to indicate whether it's healthy or not. However, you also have chronic patients who are weak. And the chronic patient that is weak really indicates that even their dhatus have started to deplete because of their problem, or because of the grahani. And that's typically the kind of patient that we find. When the more chronic the grahani, the more it translates into malnutrition, and therefore malnutrition of the dhatus as well. So for instance, in the case that we had talked about, where I had demonstrated, I was telling you that, our client, my client, she was saying that she couldn't even eat spicy foods. She couldn't even have lemonade because she would feel the burning sensation going down. And that really indicated that her mucosal lining, or that basically that Kledika kapha, the kapha that is needed in that part of her GIT, has depleted so much that she's not able to handle the normal amount of heat intensity of these sort of substances. She couldn't even drink hot water without feeling it burning going down. So because of that, ideally, I would have liked to put her on more number of therapies. However, her body strength couldn't handle it. Her tissues couldn't handle it. So we needed to opt for something that was milder and slower, but at least that it wouldn't aggravate the problem even further. So that's why at first I gave her just takra alone, or just takra with one of the spice herbs, instead of adding in too many things. After a couple of weeks of doing takra, then I introduced guruchi, which was, again, it's quite good in the sense that it does increase the agni. It does really help with the whole issue of grahani. But also the thing about guruchi was that it has a very high calcium content, and it would really help to reduce that intensity of burning that she was feeling. And also the thing about guruchi is it is a rasayana. So because it has that rasayana property, it also helps to rejuvenate and rebuild back the dhatus. That's what rasayanas do. They help to rebuild the dhatus. So because guruchi has these properties, as the single herb of guruchi alone added along with takra really helped to then add another level of therapy for her. And even though it was just guruchi alone, it kind of acted as an antacid. It's sort of a natural antacid because of the high calcium content, because of the fact that it's a rasayana, and it really helps to give that protective effect of the mucosal lining and of the GIT as a whole. I introduced that in. But in the beginning stages, she couldn't even handle the guruchi. The guruchi would have been too much in the first stages. So as she took the takra for a couple of weeks, it sort of created the environment that her body was getting used to that now, and was getting used to increasing her agni a little bit. And she can somewhat handle just the heat or the intensity of just her jataragni increasing. So then once that it has prepared her GIT, then I introduced the guruchi so that it can then go one step further. Okay? Okay. Yes, so it is based on bala. It's based on the bala of the patient. So the strength of the patient, looking at the integrity of their tissues, looking at their ojas, looking at where their situation or where their actual current condition is at. Okay? You also mentioned the guru rogi and someone whose mind sees the problem as bigger than it is. How do you pacify the vata while treating the pittaja ashas? Even in the pittaja, there's a chronic vata imbalance of the mind. So even when you have these guru rogis, doesn't necessarily mean it's a chronic imbalance, vata imbalance of the mind. Sometimes it's just someone's personality. It's not necessarily an imbalance, it's just how they perceive things. So a guru rogi or a laghu rogi doesn't necessarily mean that they have not really a dosha specifically in their mind, but it's just their perception or their personality. And so a way to figure that out is, ask them how they reacted to something in their childhood, and or are they able to withstand certain types of pain, or certain examples that you would ask them, sort of these leading questions that would kind of indicate to you whether they're a person who can withstand difficult situations, or if they find even mildly challenging situations very challenging. So give them a scenario and see how they react to that. And that would give you an idea as to if it's their personality type. Because some people do. They have that personality type. They just feel things more than others, or they are much more sensitive to those sort of situations. So in that sense, you'll usually be able to tell by how they answer the question and how much they're describing in comparison to what their body is actually showing you. Okay, So it's not necessarily an imbalance of the mind. Sometimes it can be in the extreme cases, like in a person who's a hypochondriac. In that case, yes, it is a Vata imbalance of the mind. But it doesn't necessarily mean that all people who are Guru Rogis have a Vata imbalance in their mind. Okay, so you look at even in that situation also, you want to look at the intensity or how severe that symptom is. Okay, okie dokie. So today, I started off talking before we even got to say hello. So welcome back, everyone. It's so good to see you. You know, better late than never. That's fine. So today we're going to talk about a condition known as Bhasmaka, also known as Atyagni. Okay, so Bhasmaka, I'm just going to put it in the chat here. Bhasmaka, or also known as Atyagni. Okay, they're both the same thing. Charaka uses the term Atyagni. The other text that came after Charaka uses the term Bhasmaka. Okay, so in that, as you can see, which the term kind of describes it to you, is where the Jataragni is actually too strong. So till now we've talked about conditions where the Jataragni is low, or where there is a depletion, or it's in a manda state, or the grahani is weak, or there is ama production. Okay. However, today this condition is the complete opposite of that. What happens when your Agni is too strong? Or what happens when it's way too high? There is a condition where it can be too high as well. And even that is a disease state. Because if the Agni is too high, what happens is it starts to burn off your food. So you think, okay, well, in digestion, isn't that what we wanted to do? We wanted to burn the food, or we wanted to cook the food. The difference between a healthy, normal Agni, or even a regular sort of Tikshna Agni, and this condition is the fact that it doesn't just digest the food, but it actually burns off the nutrition in the food, as well as the Agni is so strong that it also increases all of the other types of Agnis. So for instance, it also increases the Dhatu Agnis and the Bhuta Agnis. So therefore, it starts to burn off that nutrition as well. Instead of processing the food and breaking down the food so that the nutrition passes on to the Dhatus and then further break that down at each and every Dhatu, instead what it does is it burns off all the nutrition of the food in the stomach itself. So there really isn't nothing that's being passed on. However, once that whatever is the little that is being passed on has no nutrition left, so the Agni that is there at the Dhatu level starts to digest the Dhatu itself. Instead of nourishing it, it depletes it. So in the Bhasmaka condition, it's literally incinerating. Bhasma means incineration. And so in this condition, it's incinerating your food. And slowly, slowly, it can incinerate the person on the inside. I know that's very graphic and kind of yucky, but that's kind of what happens. It starts to break down and starts to deplete the person gradually. Okay, the worse it gets and the longer it is, the more depletion you start to see. Okay, so the description of Atyagni as per Charaka Samhita, it says, if a person with diminished kapha and pitta is located in the site of Agni. So in this part, you're actually looking at the fire part of Pachika Pitta, not necessarily just the Jataragni alone, but it's the fire part of Pachika Pitta and the intensity of that fire that also helps to enhance the intensity of the Jataragni. And also that Ushmar, the heat from that, also translates and aggravates and increases all of the other types of Agni as well. So how does that happen? It's Pitta along with, or aggravated along with, Vata. And which Vata are they talking about here? Does anybody remember? It is the Samana Vata. Okay, remember the Samana Vata is always responsible for the intensity of Agni. So when Vata, this Vata, along with the Ushma of Pitta, or along with the fire part of Pitta, when these two get together, they start to affect the Jataragni and make it increase really, really high. And so that causes, that further aggravates Pitta. It makes the Agni very strong, and because of that, it causes malnourishment in the body. Okay? And along with Vayu, the strengthened Agni surrounds the food. So it actually engulfs or it incinerates the food as well. Okay? And because of the sharpness, it digests the food very, very quickly. So the food gets digested very quickly, even if it's taken very frequently. So usually a person who has this condition tends to want to eat all the time. Okay? And I know, as I'm saying this, you guys there already should be little ideas popping into your head. Oh, I think I know someone like that. And what happens is, even when it starts to digest the food, even when it's taken very frequently. After digesting the food, it starts to even consume the tissues, or it starts to break down the dhatus. And the patient then can become very weak, and maybe it can result in them losing their life, depending on how chronic it is. So hopefully at this point you guys would have gotten some idea as to what that means. This typically translates to someone who has a very, very, what we would call, or what you would typically hear of as a very high metabolism, or a hypermetabolism. In this situation, you usually find hypermetabolism in teenagers. And this is it's a very similar condition. Bhasmaka is very common with teenagers. That is a normal transition. That is a normal presentation of a very Tikshna Agni. And the reason why that happens in those teenage years is exactly what's described in the pathogenesis of this condition as well, is the fact that because of the transition in the puberty age, that the Pitta condition tends to be very predominant. Pitta dosha tends to be predominant because Pitta is responsible for hormones and hormonal release. And it's also responsible for transformation. There is a lot of transformation that's happening in those teenage years. So Pitta naturally tends to be increased. Because of that, the hormone release and the release of that function, or the initiation of this change, is also carried out by Vatta. So you see the combination of the Vata properties, or the Vata function, the normal healthy function, and also the Pitta function in there. These two combined together is what the sort of the side effect, or the sidetrack, or what happens as a bystander for puberty and for those teenage years, is the fact that the person feels really hungry and they have an extremely high metabolism. And you know, what we usually think is, oh, we have a great metabolism, we can eat anything we want. But if in a healthy stage, in a normal stage of life, that Agni increases only at that time, and then it goes back down again. And if you continue to eat in the manner that you were eating when you had that strong Agni, that's when it starts to catch up with you. That's why you typically have this issue with the freshman 15, because by the time you become a freshman in college, all those puberty years and that transformation has completed. You've now transformed into a different stage of your life, and you're no longer going through those pubescent changes. So because of that, all of the increase of Agni and the increase of metabolism slows back down. But you've already created this habit of eating a lot, or eating anything and not gaining weight. And so if you continue that habit, that's when you end up packing on the pounds in your freshman year of college. That's why you typically get that freshman 15. Okay? So what are the signs and symptoms? Pretty obvious. If a person has Bhasmaka Roga, they tend to feel hungry all the time. they tend to want to eat all the time. They usually do not gain weight because of the fact that their food is being incinerated in their stomach. So there's no nutrition for their body to gain. And what also they've described here is that once the person feels satisfied or they feel happy after eating, however, the food gets digested very quickly. And after the food is digested, they get so hungry that they end up having tremors, or they end up shaking because they're so hungry. So that's a very good example of like what happened during the weekend when I got really hungry and I couldn't think anymore. And it was very much like that it was so high that, because of the lack of food, started to tremble a little bit. Okay, so because of this condition, the person can suffer from morbid thirst, like extreme thirst, from breathing difficulties or breathing irregularities, obviously burning sensation in their body, and they may also, you may also find bouts of fainting. They may also faint, and that really indicates the extreme amount of pitta in association with vata. Okay, so I can give you a great example of this condition because that was me. When I was a teenager, it was partially also because of the teenage years, but for me, it extended even beyond the teenage years. I had an extremely high metabolism, which I thought it was a metabolism. I could eat anything I wanted. It would not gain weight at all. And I was actually eating the same quantity of food as what my brother, who was 3 years older than me, what he would eat, I would eat the same amount. I would eat the same amount of food that my dad ate. And I would not gain a pound. I couldn't gain weight at all. It was very hard for me to even manage to put on even a pound because I did have this condition. And the similar symptoms, what they mentioned, I had those as well. I used to feel this extreme burning sensation. And I used to have that extreme thirst. I would drink water like crazy. I didn't have the breathing difficulties as such. But I did have, I would break out in rashes, and I also had the sweaty palms and soles. I would sweat profusely. I still do have the sweaty palms and soles, but it's not as bad as it used to be in my teenage years. So typically, like I mentioned, in your teenage years or in that transition, this is somewhat normal. However, if it continues beyond that transitional period, then it's abnormal. Then it is actually a pathological condition where it's too much of pitta and too much of vata that are combining, and it is manifesting as a condition in the stomach. Okay? So because of that, because I knew I had this condition, I would go on. That's a good question. I would go on eating. And so the poop, what does the poop look like in this condition? Great question. The poop actually looks really dark and somewhat constipated. And the reason why is because the Agni is so strong that it really burns off. It literally burns your food. So what does something burnt look like? It looks charred and it looks dry. And so that's exactly what the poop looks like too. It's pretty dry, it's pretty dark, and also they usually end up with issues like constipation, which just further aggravates the condition anyway, because that again aggravates vata even more. So I did have that. In those days, it would alternate. And here again, you can see the combination of both the doshas. Sometimes I would have diarrhea, and sometimes I would have constipation. It was never regular. So here you can see the diarrhea factor is when there's too much of heat or too much of pitta. You end up with the loose motions, because the body, what happens with loose motions, there are multiple ways it can manifest, either due to the grahini being weak, or also sometimes if there's too much heat in the body. One way of the body releasing heat is by passing out motion, because in that bowel evacuation, heat is also being released from the body. So you notice when there's a pitta sort of bowel evacuation, they'll say that they feel like there's heat coming out, or it may be associated with itching and burning, or they feel like there's a rash in the perineum. that's typically a pitta type of bowel evacuation, when there's extreme pitta or higher aggravated pitta. And that used to happen. Sometimes it would be like that. And then sometimes when it's more of Vata predominance of this condition, it would end up being constipation. And not just like regular constipation. It's not a good amount that comes out. It would be little amounts that would come out that's very, very hard and sort of shriveled up. That's because there's really nothing much to create even the bulk of a bowel. Okay, so that's sort of how it presents. Now, the one thing about this condition is, if the person feels that, you know, having a strong Agni can be somewhat good. Yes, of course, it does burn off the food, and you won't necessarily have so much of nutrition. But the person then develops the habit of eating really heavy amounts of food, heavy food, large quantities, and not gaining any weight. If you habitually continue with that, it eventually will end up in the opposite position. So what happens is you develop this habit of eating whatever you want and really not healthy foods. And then what that does is that slowly will start to then decrease the Agni. It will start to pacify the Agni. It will start to lower it to the point where they will still continue eating that way, and it will actually start to end up with overnutrition condition, where there is too much of nutrition, or basically the body starts to pack on the pounds. And that again is exactly what happened to me. So I had the habit of eating a lot of food, because that's how it was, you know, up until I was 20. That's how I always ate. I always ate a lot of food, very nutritious food, because I was a vegetarian, and always fresh cooked food. So it was very, very nutritious, but it was just a lot in quantity. I ate all the time, and I could eat, you know, all the junk food too, and I still wouldn't gain weight. So I always felt that was okay. I could eat it and nothing would happen. However, as slowly it started to change, and it started to calm down, because the Vata started to pacify a little bit. And in the pacification of Vata, what happened is the Agni slowly started to regulate and come back down. And once that came back down, I still had the habit of eating all the time. So then that's when I started to not be able to digest my food, but also the fact that it started to accumulate and started to build and build and build. And very, very quickly, I ended up gaining a lot of weight, because my body wasn't able to handle the amount of food. I didn't have the Agni anymore. So it couldn't handle the amount of food that I was eating. So it was very quick to put on the weight. Another example of what I want to mention here in this condition, because it was, again, a very high Pitta and Vata condition, it also translated in irregularities in the menstrual cycle, which is another thing that you're very commonly going to see, especially in young women, that they have, when they have this issue, this can even, depending on the intensity of how bad it is, it can also translate into irregularities in their menstruation, because of the extreme Pitta and because of the Vata not moving in the proper direction, moving upwards instead of downwards. They may have longer gaps between menstruation. They may have severe, either longer gaps or long periods. Like, for instance, instead of it being 3 to 5 days, it'll end up being 7 days, or it could be even 10 days, where it's too many days of bleeding. That can also happen because, again, if it's too many days of bleeding, it's because of the high Pitta. If it is too long of a gap between periods, it's because of Vata. Because Vata initiates it. Vata is responsible for keeping it coming out at the proper time and keeping that cycle regulated. And Pitta, what happens is, if Pitta is too strong, it'll cause more amount of bleeding. It doesn't allow the channels and the structures to rebuild and to stop. So it just keeps bleeding, because, again, that is another way of the body to let the heat out. Okay? So it can happen in both ways. And that is, again, another very common condition you're going to come across. Can this cause heart palpitations, heartburn, low testosterone with exhaustion? It can cause heart palpitations if it's very bad. Yes, it can cause heart palpitations. Heartburn, to some extent, yes. In a person who is of a pitta prakriti and they have this condition, yes, it'll feel like heartburn, because they feel that burning sensation. They can feel that burning sensation all throughout their body, like osha plosha, or they can feel that burning sensation just in the GIT. Okay. So yes, and I'm not really familiar with versus low testosterone with exhaustion. It's not necessarily like that, but it's very much, it's typical symptoms of a very high overactive metabolism. Okay. So what do you do? What do you do when someone has this condition? What's the treatment for it? Now, again, here it seems that the treatment is counterproductive. The treatment is you need to eat food or consume food that is very heavy to digest. Consume food that is more cooling in nature. Okay. It should be unctuous. It should be snigdha. It should be guru, heavy. It should be slow, manda, in the sense that it has that manda guna. It sort of slows things down. It should be shita virya, cold in potency. And it should be stable or sthira. Okay, so these are the qualities that in the food, the different types of food that you want the person to have. So as I was just mentioning, if you overeat so much, that would actually cause it to suppress the Agni. Yes, you do kind of want to suppress the Agni in the beginning. So in the first stage of treatment, that's exactly what you do. You actually try to suppress the Agni. However, you need to keep track of it. Once the Agni starts to regulate, at that point, you need to stop that diet. Okay? So what happens is you need to take food, all of these type of foods that will help to pacify pitta, and which also help to move the pitta out. Okay? So in the sense, so an example of that is food like for instance, biryani or stews. Stews are a great example. Like a clam chowder or a beef stew. These are things that are really heavy to digest. They're substantial. It gives some substance for the Agni to work on. So the person, it'll take longer for them to start to feel hungry because the Agni is still working on that really heavy meal. Okay, so, and what that does is that keeps them satisfied. It makes them feel like they've had some sort of substance. It keeps them satisfied. But in the process of how it's been cooked, it also will not further aggravate pitta or vata. Another great example of this is like Thai dishes with coconut milk. Okay, coconut milk, because of the milky nature of it, actually pacifies pitta and vata. And because it's coconut milk, it naturally pacifies, again, pitta. So dishes with coconut milk is a great example. They don't necessarily feel as heavy when you're eating it, but it does take a while for it to digest, and not necessarily, it'll keep that person satisfied. Okay. So like Thai dishes with coconut milk, that's a great Thai dishes with coconut milk, and that has some form of protein. In Bhasmaka Roga, this is really where a person needs to eat protein, because proteins are the one things that will keep the Agni busy for some time. It'll keep them satisfied and it'll keep their hunger pacified for a while. And also what it's going to do is it's going to provide that nutrition. It's going to help to rebuild their dhatus. So that is another reason why they need to have some form of protein. Okay? So in this condition is where we would actually advise someone to start eating meat. If they don't eat meat, they need to start eating meat. Ice cream too cold for Vata? No, actually, this is a condition where you could. You would think, again, we don't necessarily want to always, we don't want to advise against eating ice cream or against eating that. In this condition, they can. To some extent, they can even eat the salads too, because the salads are heavy to digest, but they have an Agni as such that needs that kind of substance, so they can eat salads. But their sort of salad should, again, be something with a meat. So even though it's Viruddha, remember in Viruddha there was an exception. If somebody has a really, really strong Agni, they can consume Viruddha aharas. This is one of those examples. This is a condition where they actually need that Viruddha ahara, that particular type of combinations that makes it heavy to digest. In a person who doesn't have Atyagni or doesn't have Bhasmaka, if they consume Viruddha ahara, it produces unwanted effects. However, in a person who has this condition, they require that kind of Viruddha, or that kind of combination, so that it would be heavy to digest, so that it would pacify their condition. Okay? But the main thing to do is, the first step is to suppress the Agni. The second step is to see when the Agni starts to regulate. In the suppression of Agni, what's going to happen, instead of the person feeling hungry every hour or every 2 hours, there's going to start to be a longer gap. So you'll notice that if they eat something heavy, it'll take maybe 3 hours or 4 hours before they start to feel hungry again. It will sustain them. So once that Agni or that hunger starts to regulate, and you notice that they're not necessarily feeling so hungry as often anymore, and maybe they are starting to put on a little bit of weight, or even if weight, but you start to see the difference in the glow of their skin starts to look more healthy, then at that point you know that it's starting to regulate. And that's when you want to wean them off from that heavy diet and bring them back to a normal diet. Not a very easy to digest type of food, and not a very heavy type of food, but a normal, moderate diet. So that's a moderate diet of all 6 rasas, a predominance of all 6 tastes, and food that is nutritious. Okay, so they need to have all different types of vegetables, different types of meat that is for, you can transition from the heavy meat or the red meat to more lighter types of protein, and they can have that in the moderate diet. And once that again starts to regulate, at that point you can also start to add in certain rasayanas. So rasayanas that are heavy to digest again. This is again another good example for the use of Chyavanprash or Chyavanprasha. Okay, Chyavanprasha is actually in the original composition of Chyavanprasha, and this is hard because sometimes you don't necessarily get that. A lot of the companies that are out there are not original. And we had this discussion as well. What does normal, healthy Chyavanprash or real Chyavanprash taste like? And real Chyavanprash tastes like amla. It should have that amla taste and amla smell. But anyway, this is a great condition where Chyavanprash would actually be very useful, because it is a rasayana, so it'll help to increase and rebuild the dhatus, which have been malnourished. What it also does is, because of the combination or the formula, it has a lot of ghee and sugar, rock sugar. So the combination of these two actually make it a little bit difficult to digest. And because it's slightly difficult to digest, it again, it pacifies their hunger. It keeps them something substantial to them. And so that really helps to further give the nourishment that they need. Okay, so that's one way. So this is one way of fixing Sorry about that. Something happened here. Okay, so Chyawanprash is a good example of how you can give a rasayana to help to rebuild the dhatus, and also to give something substantial for their agni. Okay. Okay. Other examples of things that you can do here in this condition, they can have milk pudding, or for instance, those yummy milk sweets that you get in the Indian restaurants. That is a great example of when you can have that. So have have a field day with it. Eat as much sweets as you like, because if you have an agni that like that, you can actually digest it. But the reason why they say, again, milk sweets is because of the composition of what you're eating. It's not just eating anything, but in the composition of these milk sweets, the milk, again, helps to pacify both pitta and vata. And because sweet taste, remember when we looked at the composition of different tastes, what you guys learned in the beginning, sweet taste is one of the tastes that actually, again, pacifies both pitta and vata. So a milk sweet is, again, an ideal combination of something that will help to pacify this condition. Okay, so eat as much of those milk sweets and milk puddings as you like. That's a great combination of a drug or a formula that can be useful for this condition. Okay. They also mentioned that the person can have milk boiled with rose water, milk boiled with cardamom. So golden milk, an example of golden milk, is again another really good combination that's going to help with this condition, because again, it's milk that's sweet with turmeric and cardamom. All of those things in combination, again, help to pacify both pitta and vata. And it's substantial. It's slightly heavy to digest. In a person who doesn't have this type of agni, it would be very difficult for them to digest. But in this situation, they have the agni, so it'll be ideal for their kind of digestion. Okay? Okay, so that's just some examples of what you can do. There are basically only two major things you need to keep in mind. In the beginning part, you need to give really heavy foods, like with those qualities that I described. And then after that, you want to give them rasayanas. Once the agni starts to regulate, then they need rasayana. Okay, so examples of rasayana: Chyawanprash, milk sweets, golden milk. These are all rasayanas that are really helpful. Okay. So it's a fairly small topic. Do you guys have any questions? I will open it up for discussion, since today was a little bit of a informal session, I would say. We can open it up to questions, and you guys can feel free to speak if you like.
So how is this different from Tikshna Agni?
That's a good question. It is actually different than Tikshna Agni. So in a Tikshna Agni, it usually means that the person's food gets digested much faster. But what the difference is, in Tikshna Agni, it doesn't incinerate the food. So this is a much higher version, or a more aggravated version of a Tikshna Agni. You have Tikshna Agni that is still it's a normal presentation of Agni, like in the sense that you can find it in a prakriti of a person, where it's a little bit higher than normal, but it's not producing a disease condition. Tikshna Agni will not necessarily produce malnutrition. Tikshna Agni will not produce those changes in the dhatus. But this condition is one step above Tikshna Agni, where it is so high that it stops the person from getting any nutrition. Tikshna Agni doesn't burn off the nutrition in food, but this condition will burn off the nutrition in food. Okay? So the difference in Tikshna Agni, how you would be able to tell, is the fact that a person with Tikshna Agni can eat food and they will feel hungry again within 2 to 3 hours. But when you look at the integrity of their dhatus, you look at their actual state of nourishment, their state of nourishment will still be okay. Whereas a person with this condition, Bhasmaka, they will be able to eat. They feel hungry within an hour or two, but they also show signs of dhatu malnutrition. Okay? Is Bhasmaka and Atyagni the same thing? Yes. Bhasmaka is Bhasmaka is the term. What that means is it's incinerating. Okay, so it incinerates the food and it can also incinerate the person. Atyagni means it's the same as Ati Agni. Ati means a lot or too much, and Agni is Agni. So it's too much or too high Agni. Okay, so that's why you have Tikshna Agni, which just means it's strong or penetrating, but they have given it a different term. They've given it a different term as Ati Agni, which is too much of Agni. It's too high. Is complexion usually affected with blemishes? Yes, you will usually find with Bhasmaka Roga that the person will they will start to exhibit the signs of excessive pitta. Excessive pitta and vata. Vata you'll find somewhat, but in the skin, typically pitta is the first thing to start exhibiting, because skin is a byproduct of rakta dhatu. So therefore, rakta is again another seat for pitta. So whenever there is aggravation of pitta, the first place you start to see it is in the skin. So absolutely, they will have blemishes. They will have those very bright red cheeks. It may very much result in sort of heat rashes, which again, that was one of my conditions. I used to break out in heat rashes all the time. And it made it very hard to live in India with this condition, because that meant that anytime, any day it becomes hot, or if I sweat too much, or if I don't drink enough water, I would break out in a heat rash. I used to almost always have, where I would have rashes on the sides of my palm. All along here, there would be heat rashes, all on the sides of my feet, on the soles of my feet. Not at the bottom, but on the sides. That's where I would end up having the heat rashes. I used to have a lot of burning in my eyes. And I would find that was the time when my hair started falling a lot too. I used to have really long, very thick hair, but again, hair fall is another indicator of very high pitta. And when it started to become very strong and very intense, I started to have a lot of hair fall. So much so I think I lost around 40% of my hair. Yes, you will find rosacea as well. That's very common with this condition. So, and if you're looking at all of these signs and symptoms are indicative of excessive pitta or aggravated pitta. All of these are aggravated pitta symptoms. So almost all of the aggravated pitta symptoms you will find associated with this condition. And the thing is, it seems so abstract. It doesn't really seem like a real disease. It just seems like, the person just has a high metabolism. But it can, the thing with this is, if it goes untreated, it can then be the initial factor that then develops into a much deeper pathology. Because what happens is, at first you have the person that is like this, right? And the more this condition aggravates, what happens is, instead of, say this is the health of the tissues, the more this condition happens, or the longer or more chronic it is, it starts to deplete. So this goes away, okay? It starts to deplete. Then it starts to deplete some more. And it keeps widening and widening and widening till you end up with just a thin wall, okay? And what then that happens, the more chronic it becomes, it transforms from a pitta vata condition to more of a vata and slightly pitta condition. And can you see why that would happen? In the beginning, in order for it to get to that severity, it needs pitta. it needs a predominance of pitta. But the more and more chronic it becomes, and the more you're adding in other things that would further aggravate pitta or further aggravate vata, it depletes the body, it depletes the tissue. And once there is excessive depletion, vata takes over. Vata becomes more predominant, and then it morphs into a vata condition than just a predominantly pitta condition. So this is a good example for you to see how even it can change. It can start off like a pitta and it can change to vata. And that typically happens with, yes, absolutely, they can absolutely end up with osteoporosis, because it's very much like that again. It is a degenerative condition, malnutrition. And another reason why it would end up with osteoporosis is because osteoporosis is, again, another vata condition, extreme vata condition. Because remember, vata, it's seated in the bones, right? The adhisthana, or the seat for vata in the dhatus, is the bones. So the thing about that, the relationship with vata and the bones is, it's an inverse relationship. Whenever vata increases, the bony tissue decreases. And whenever the bony tissue increases, the vata decreases. Okay? So that's exactly what happens in this condition. And that usually tends to happen in the chronic stages. Hence, again, why they need rasayana. So when you pacify the Agni and you bring it back to somewhat of a normal state, then they need rasayana. They absolutely need rasayana. Is skin cancer also a part of this? It can be. It can be. It's not necessarily the case, but there may be conditions where it would have started off as this and had other trigger factors that have led it to then settle and manifest in the skin. Yes. So it's not to say everyone who has this will end up with skin cancer, but it can mean that the person is susceptible to having that, or the person, if exposes themselves to other factors that is conducive for cancer growth or to affect the mamsa and medu dhatu, then yes, it can become that as well. Okay, great. Anyone else want to ask some questions? We still have about 15 minutes. You can feel free to talk if you like.
Okay, rather than type it out. So teenagers are okay with this process in their puberty, but being mindful that you can't keep this up as they get older.
Yes, yes, absolutely. In teenage years, that is a normal presentation or a normal transition where this happens. It's pretty common. So that is, again, a normal abnormality. It is a prakrita change. It is a normal change that's happening in the body. That's why it's producing this sort of effect. However, this condition can happen even beyond these teenage years. And when you find this presentation happening in someone that is not in those teenage years, then that indicates that it's not just because of the normal transition, but it is an abnormality. It is a vikrita vikriti. Remember, before we were talking about prakrita vikritis and vikrita vikritis. If there's too much terminology here, don't worry about it. But I want you to get used to hearing that term, a normal abnormality and an abnormal abnormality. And what they mean by a normal abnormality or a prakrita vikriti is prakrita is what is expected. Remember, we know that there is an expected rise of the doshas in different seasons. There is an expected rise of the doshas in different times of the day and different periods in your life. similarly, this is a normal transition or a normal rise of the doshas in that transition period from childhood to early adulthood. Okay? So because of that, this is a normal thing that we expect. It is a rise in the doshas, it is an aggravation of the doshas, but it is an expected rise in the doshas. So it is a normal abnormality or a prakrita vikriti. When this also occurs despite that time, it's not happening at the normal time when we expect it to happen, but it is still manifesting despite the fact that the person is not a teenager anymore. If this is happening in if they're in their 20s, if they're in their 30s, if they're in their 40s, then that indicates that that is a vikrita vikriti. It is an abnormal abnormality. Okay? So hopefully that's clear what that means, an abnormal abnormality. It should not be happening, but it is still happening. So if it is still happening, this rise or aggravation of the doshas, then that is considered a pathological state. And that pathological state is what we need to really address. For a teenager, you don't really have to worry about it too much. Just supplement enough to know that this will change, and be aware of when the high agni or the atyagni starts to calm down. But if it's apparent or you're seeing this presentation in someone who's not in their teenage years, then that's when you need to actually induce the change, because that change isn't going to happen unless you intervene. Okay? Can Tikshna Agni progress to this? Is this Vata pushing Pitta or Pitta pushing Vata? Do both doshas rise together, or is it one increasing the other? I wouldn't, it's kind of both ways. It can happen both ways. Not necessarily the doshas pushing on each other, but it's, how we describe it is, if you have, for instance, you have a Pitta Prakriti person who has these Pitta qualities, right? And the Pitta Prakriti person they're taking in other factors that further increase Pitta. It goes on increasing the Pitta and increasing the Pitta and increasing the Pitta. If that person, if they are a Pitta Prakriti person, they naturally tend to be more inclined or very easy for their Pitta to be aggravated, right? Because they already have a lot of Pitta qualities in them. So it's very easy for Pitta to be aggravated. They're prone to Pitta conditions. So in that case, it starts with Pitta. If these other factors that they are exposing themselves, and the reason I put it is as arrows coming in, it's because it is things that they're introducing to them into their body. So when these qualities are being put in that increase Pitta, it tends to be Pitta that is augmented or that is helped, supplemented with Vata. If it is a person, similarly, a Pitta Prakriti person who has a Vata issue, if they are adding in qualities that aggravate Vata, it's very easy for the Vata to combine with Pitta and aggravate it in that way. Okay? So it can manifest in both ways. It doesn't necessarily mean it has to start with Pitta or it has to start with Vata. It can start with Vata or it can start with Pitta. But when it manifests, it's usually a combination of Pitta and Vata. Okay? Because those two combined is what makes it gets the Agni to get so strong or so high. It won't just happen with the Pitta alone. The intensity, if it was just Pitta alone, it would rise only for one small period of time. And then as that Pitta suppresses or goes down, this will also go down. But if it is with Vata, Vata is what keeps it going and keeps the intensity of the fire for a longer period of time. Okay, that's why these two combined is how they aggravate the Agni. Okay. Any other questions? No?
How about like low blood sugar? When you talked about the symptoms of fainting, would that be part of it?
That's a very good question. It is very similar to that. It is very, very similar to that. So for instance, in a person, this is why this is funny, because a person who is hypoglycemic is, or hyperglycemic, if they're hyperglycemic and they have these tremors, or what is it? If you're low blood sugar and you have, yes, low blood sugar and you have tremors, it's very similar to this. It's that, and the reason why their sugar goes low is because the Agni goes so high and it burns off their nutrition. So their body is kind of craving nutrition. So you can have low blood sugar in those variations in diabetes. And you can also have low blood sugar otherwise too. Usually you find this highs and lows in diabetes when it gets into a chronic stage. In the initial stages of diabetes, you won't necessarily find that. But in the later stages of diabetes, when it's uncontrolled and it starts to become more chronic, that's when you start to find these ups and downs. And the reason why is because though it is a kapha predominant condition, it's not only kapha, but it is kapha predominant. When it becomes more chronic, vata starts to set in. In any condition, regardless of what the disease is, whenever it becomes chronic and whenever it's long-standing, vata naturally starts to get aggravated, and vata joins in the problem. Because if you look at a pathology, in any pathology, whether it be a kapha pathology or a pitta pathology, the fact that it is a pathology, it means that it's a disturbance, right? It is a disturbance in the function, it is a disturbance in the qualities, and it can be a disturbance in the actual quantity of the dosha. So the longer that disturbance happens, the more it's going to start to affect the flow of vata, right? Because remember, vata is constantly flowing. Vata is responsible for the initiation of all the functions. So when these functions are aggravated, when these structures are aggravated, or when they are blocked, vata is actually blocked by the physical increase of the quantity of the dosha, then the longer that starts to happen, then the more vata starts to aggravate. That's why in any condition, when it gets to that chronic stage, vata will be there. Vata always has to be there. Vata will also be aggravated. And the worse and worse it gets, the more aggravated vata gets. Okay? So the reason why even in the diabetic conditions you find this is it's not necessarily because of a pitta association there. It's because of that rise of vata that's moving up, the samana vata, and then the fall of the vata, or the vata moving back downwards. And that's why you find that ups and downs in their blood sugar, and the ups and downs in their appetite, and what their body needs and what it doesn't, or how much their body is craving or it's not. You find that in diabetes, and that's typically in the chronic states of diabetes. Yeah. Okay. So a question for Bhasmaka Roga is Bhasmaka and Atyagni the same thing? That's a question. Okay. Okay, so what is the nidana of Atyagni, Vihara, genetic, dosha, all of the above? It is, the causative factor for this is actually, it is pitta aggravating factors as well as vata aggravating factors. So It can be because of activity. It can be because of ahara or diet. It can, in some cases, it can be genetic. Certain cases, not always. If someone has, if in their family, they have this sort of body type where their family members tend to have like a higher metabolism, or they naturally tend to have this issue, which is typically, again, an aggravation of the doshas from embryonic life onwards, or from uterine life onwards. So that's why they end up with this condition as well. It can be genetic. It's all of the above. It really is. And it's a very obscure sort of condition. That's kind of why I wanted to share it with you, because you do come across it, and it comes off more as more of a sign or a symptom than an actual disease. But it can be an actual disease. And if it's left untreated, it can then develop into a different disease. So it would have started off as just Atyagni or just Bhasmaka, and then it can then further develop into another condition, depending on where the weakness is in that person's body, or also depending on what sort of ahara vihara they are further subjecting themselves to, that can cause an even secondary pathogenesis. Okay? Is that clear? Does that make sense? Okay, so we are almost out of time. I hope this has given you some more food for thought and maybe confused you a little bit more, so that'll generate some more questions and some more thinking and some more aha moments. And due to, I think, a very common demand and a lot of interest and a lot of questions, next week's class we are going to talk about herbs, because I've seen this across the board now. Everyone seems to be asking about the herbs and the qualities of the herbs and how do we know what herbs to use. So next week we are going to discuss some of the herbs that are there, in that not just the combinations, but we're actually going to break it down and talk about the properties. So by looking at the properties of the herbs, when we talk about rasa, guna, vidya, vipaka, that's what they mean. In each and every substance, they have defined it by rasa, guna, vidya, vipaka. So we're going to talk about the breakdown of some of the common herbs for these conditions and how to choose and how to combine them, so that you can use them for different conditions. Okay? Okay, so I hope everyone has a good night. Next week, we are also going to be on Tuesday. Okay? Next week, we're also on Tuesday. Thank you all for being patient, and we understand that there was a little bit of mix-up, but we really appreciate your understanding and patience. Okay? Hope you all have a very good night. Take care.
Thanks, Nusha.
You're welcome.
Thank you.